Good morning, everyone. The bells at 10 a.m. remind us of our journey. Many days dark, many days very difficult. But today, we're here to mark an important and a very hopeful milestone in our fight against COVID-19 in the Commonwealth. Today, in just a few minutes, several Kentuckians will receive their shot of hope, wherein we will vaccinate our 1 millionth Kentuckian. It is a very exciting day. These Kentuckians will roll up their sleeves to receive one of the safe and effective vaccines we are using across this country to defeat this evil virus. And these vaccines are going to take us out of this pandemic and into a new era. This is truly both a miracle of modern medicine and a tribute to so many Kentuckians that have worked to make this happen. Think about how far we've come and how fast. The first shipment of COVID-19 vaccines arrived in Kentucky at UPS Worldport Hub in Louisville back on December 12th, 2020. That same day, we reported more than 3,500 new cases of the coronavirus in Kentucky, 24 deaths, and a positivity rate pushing 9%. 2 days later, I traveled to U of L Hospital to bear witness as our very first Kentuckians, our frontline healthcare workers, received the first vaccines to protect them from this dreaded virus that has cost us so dearly. One of the first recipients that day at U of L was Dr. Valerie Briones Pryor. The Louisville native has been serving her community at U of L Healthcare for 16 and a half years. She'd been caring for COVID patients at U of L Health Jewish Hospital since March the 17th. And the very first moment I met her, right before she was going to receive her vaccine, she had just lost her 27th patient to this virus. It's been my honor to get to know, we call her Dr. Val, a little bit. She was here just a couple weeks ago to take part in our COVID memorial service marking the 1-year anniversary of our very first case. She told us then that she's taken care of about 7,000 COVID patients, and that now 50 of those American flags that sit outside of this Capitol honor patients that she's lost. That day, the anniversary of our first confirmed COVID case in the Commonwealth, was a day for reflection. Sadly, even as we mark this hopeful milestone, we must be clear-eyed to know that this war is not yet won. This week, we'll likely cross another milestone, this one tragic. This week, we'll likely mark losing over 5,000 Kentuckians to COVID-19. My faith tells me that these are all God's children, irreplaceable people who meant so much to their families, to their friends, and to their communities. To all the Kentucky families out there that are hurting, we are with you in your mourning and in your grief. This is also why we are here to celebrate this great moment. Think of it, less than 3 months since we administered our first vaccine here in Kentucky, we're going to vaccinate our 1,000,000th person. We're administering the vaccines both quickly and efficiently. With a day to go, we have set another weekly record for number of Kentuckians we have vaccinated, with 136,648 Kentuckians vaccinated just through the end of yesterday, this week alone. Not only that, but we have now delivered 99.7% of all first doses we have received since the very beginning and put those into people's arms. This is how we honor those that have lost. This is how we honor the families that are hurting. This is how we honor people's sacrifices where their world's been turned upside down. Their bank accounts have dwindled. They've worried about their children. How we honor them is to ensure that we defeat this pandemic as quickly as possible, and we make sure that everybody counts, that everybody gets this vaccine, that we bring everybody with us to the finish line. There are now 567 vaccination sites across Kentucky, 567 aimed at meeting people where they are, providing this vaccine in their community. And we're administering them faster and faster, and we are convinced that we are going to meet the goal that President Biden set out, that we will vaccinate every single Kentucky adult that wants one of these vaccines by the end of May. That's just 2 months and a couple weeks away. I don't know about you, but I find that pretty exciting. Again, we have a lot of people to thank. Our frontline healthcare heroes and sheroes like Dr. Breonis Pryor, the volunteers, the local health department, the Kentucky National Guard, and everybody that's making these sites work. You walk into a vaccination clinic, you walk into one of these sites and you feel hope. You see people crying tears of joy while getting a shot in their arm. You see the relief and you see some of the anguish that we know that people have been feeling. You know, just this weekend, Brittany and I were with a family that we know where the woman lost her father. And the flood of emotions as she goes to every event that her dad would come to see her son and their family, again, resurfaces that grief. Most of all, I want to thank the people of Kentucky. My goodness, thank you. A year and several weeks, it's been long. I know there have been sleepless nights for everyone. We've been asked to do things that aren't comfortable. We've been asked to protect one another. We've been asked to live every single day like our actions could impact and even hurt people that we have never met. Yet the people of Kentucky have responded with compassion. They have lived for their neighbors. They have sacrificed for people that they have never met. I'd also like to single out some of our healthcare professionals, nurses, and staffers from the Franklin County Health Department who are with us here today to help administer these shots. Michelle Searcy, Angie Chagoya, Ashley Kratzer, Savannah Shiro, and Wes Clark. Thank you for being here today to help give the millionth Kentuckian their shot of hope. And with that, I'd like to introduce another one of our healthcare heroes who has stood on the front lines to help us, to protect us, and to guide us through all this. Our own Dr. Fauci, Dr. Stephen Stack.
Thank you, Governor and First Lady. It's a privilege to be here. This does mark a historic milestone in this journey, which has been so difficult for all of us this past year. This disease has upended our lives. It has disrupted our ability to interact with each other, and most cruelly, perhaps, at a time when we needed to come close together to support each other, it's forced us to stay apart to prevent it from being even more dangerous than it already has been. Today, to stand here and recognize the millionth person to be vaccinated, to celebrate this incredible accomplishment of modern medical science, to have a vaccine this quickly, to give us a chance to exit this pandemic as successfully as we hope we will as the summer unfolds is an incredible achievement, an incredible success. To the healthcare workers who have supported us through our sickness and our exposure to the virus over the last year, thank you very much. And now to those of you who are helping and volunteering in really impressive numbers around the state to help vaccinate all of Kentucky, thank you so very much. And to Governor Beshear, thank you for your leadership throughout this pandemic. Kentucky has faced losses, but Kentucky's losses have been so much less than they might otherwise have been. And so to all of us in the state, I'm very grateful for what we've done this last year and the success it represents. So, ladies and gentlemen, I do sincerely hope that this summer we can return to more of our normal lives. Until then, though, please, you're going to have to listen to me a little bit longer. Wear your masks, wash your hands, keep your distance, and please continue to follow the guidance until we get everybody a chance to have a shot of hope so that everybody can be protected from COVID-19. Thank you very much. Thank you, Governor.
Now I think we have 8 individuals that are here to mark the 1 millionth Kentuckian vaccinated. This is the only shot I've ever heard people say, please, please, can I have it? Whoever wants to be next. All right, can we get in on this one too? Yes. No, come on, Michelle. Thank you so much. Hello? How are you? Keep working. We're close, aren't we? Yes. She is. Yes. Oh. Hello. Yes. Are you excited?
Michelle is ace at giving the show.
Yeah, it feels very good. I like the taste.
It's fine.
Who's next? Come on up. That's it? Great. Let's see. We can take just a few questions.
Governor, you talked about meeting the president's goal by the end of May. Talk about the challenges in that.
So the challenge of the president's goal, having every American, but here every Kentucky adult vaccinated by the end of May, is a big challenge. It depends on a couple things. First, supply. The federal government has to give us enough doses to make that happen. We are seeing it pick up, and I expect that that will happen. Second, we have to have the infrastructure built to vaccinate people all over Kentucky. With over 500 sites, we believe that we are close to where we need to be, but you will hear us announce more additional sites, including one at Shawnee here in the coming days or week. And then it's going to be making sure that we can meet people where they are and ultimately addressing some hesitancy that's out there. But those are all things that we can do. And I expect not only will we meet his goal of every adult in Kentucky who wants a shot getting it by the end of May, I think we're going to beat his goal in opening up vaccinations to everyone before May 1st.
25% of the population now vaccinated here in the state. Meet or exceed the goal that maybe you set for yourself back on December 12th? Or
So back on, first of all, today is an incredible day that has come a lot earlier than any governor thought that it would. When we were first given numbers about supply of vaccine that we would get, this was going to take into the fall to vaccinate every adult that wanted a shot. So thanks to significant increased supply from the federal government, thanks to an aggressive strategy of building out vaccination sites, we are significantly ahead of where we thought we would be on December the 12th, and that is good news. The better news is it keeps picking up. I expect that if our pharmaceutical manufacturers continue their rate, that we might beat that May 31st deadline as well.
Well, that was my next question. Do you anticipate the final 75% may
Well, certainly the very first shots we got were limited to who we could give them to and limited to who could give them out when we looked at the Pfizer vaccine and what it took and who it could go to. But what we are seeing now is, as of today, we've put 99.7% of all first doses we have ever received into people's arms. And we vaccinated 136,000 people this week with 1 day to go on our vaccination schedule. So it will go much more smoothly. It'll go more smoothly for Kentuckians too, because what's not smooth for them is when they can't get an appointment. And that is all driven by supply. And as supply increases, as more people have been vaccinated, it will get easier.
Governor, how do you think Kentucky stacks up against the rest of the country in terms of its vaccine administration?
Oh, I think we stack up favorably against any other state across the United States. Now, we judge ourselves primarily on how fast we get that first dose out. It's because we view the second dose as very specific for an individual, and we'll take a little more time if it means getting them fully vaccinated. But the speed of our first dose rivals anybody. But let me say this, there's a lot of articles or a lot of attention based on how state A is doing against state B. We got to get all of America to the point we need to be at to ultimately get back to some sense of normal. So my goal and my hope is that every state continues to improve, and they are, and supply will fix a number of the problems that some states are having. So while I like stacking up well against other states, we need everybody to do a great job.
Governor, a budget question, if you don't mind. I'd like to know your thoughts on the proposal, particularly the area that takes away your authority to decide where COVID-19 relief funds go.
Well, where the American Recovery Act funds go, I think is an issue of federal law, but I hope it's not an issue we have to reach. We've had several meetings with leadership. We've laid out a specific plan. We're still in talks on that. I hope soon to be able to release that plan to the public, but I want to give a chance for consultation and to work on that. Certainly, we're all better off if we can all agree. We got a chance to invest in infrastructure. Our plan would create over 30,000 jobs in the next year alone. We got a chance to provide significant relief to industries that have been hard hit, businesses and individuals. We got a chance to run broadband to every single home in Kentucky. That's all possible with these funds, and I think those are goals that we all ought to be able to agree on.
Yes, President Biden said 4th of July being the date that Americans can gather together. If everything goes well, do you anticipate that happening here in Kentucky?
I anticipate we're going to be able to meet the President's 4th of July goal here in Kentucky. With the CDC guidance already being out that smaller groups of vaccinated individuals can get together, the more and more we vaccinate, the more flexibility there will be. I think that the President talking about small groups on July 4th is under-promising and hoping to overperform. We're certainly going to outperform that goal in Kentucky.
The 1 million vaccines, that's 1 million of the first dose, not everybody's had.
That means a million Kentuckians have received at least their first dose of that vaccine. And that second dose for everybody that got it today is specific to them. So when that comes in 3 weeks or 4 weeks from now, then they'll come back in for that appointment and we'll get everybody fully vaccinated. But we know you get some level of immunity with that first dose, and getting as many people through that as possible as quickly as we can is really important. All right, one more.
We've received some text messages indicating that while Kentuckians were having a hard time getting through to the unemployment office, the Lieutenant Governor and your Supervisor, Rocky Atkins, personally intervened with the unemployment office to have them take care of their friends. Don't know if you're aware of this, but I'd like to get your thoughts on that and whether that's fair to other Kentuckians.
Well, certainly during the last 13 plus months, we have had letters, calls, emails come in. And certainly when you get those requests, when you have people reach out, I get letters from individuals each day, we forward those on, which we should, to the office for them to take a look at. We have legislators send them. We have the media. I think DRV sent about 2,000 of them and asked us to take a look at them. And sometimes that helps us find issues that are out there. Certainly, nobody's position should influence where somebody is in that line, but if there are people that are struggling to get their unemployment and their information's been provided and we can send that on to the office, that's something that other officials have asked for, and that's a conduit we have tried to allow. Anybody else?
Governor, any interesting changes to or how life is going in Kentucky?
So we have had 9 straight weeks of declining cases, and that is incredibly exciting. And this last week, a lot of other states have plateaued. So certainly, if we go through this week on that, we would expect, again, some loosening of where we are. We're going to watch that pretty closely, along with the positivity rate. Thank you all very much.